Have you ever felt shut down or inadequate or like your problems aren't real? Because I have. I've been told that it's in my head, that it's all made up, and it's a really sucky feeling to have. Um, I have been in and out of therapy for 5 years. I've been with my same therapist for 5 years, but I've also tried different therapies: cognitive behavioral, dialectical behavioral, group therapy, couples therapy, family care therapy, kind of the whole kit and caboodle. So I have a pretty good background in the different forms of therapy as well as different mental illnesses because I'm also in nursing school. So I had to take advanced psychology and do clinical rotations on psychiatric floors. So I've seen a wide array of different mental illnesses. Unfortunately, I'm not alone in my struggle with mental illness. The World Health Organization estimates that every 12 minutes in the US, someone commits suicide and dies as a result of suicide. That's a pretty deafening statistic. It's becoming quite the epidemic, and every year the suicide rates increase. So it's not going in the right direction. In order to kind of ameliorate this epidemic, research has shown that the reason why this epidemic is getting so big is because of the silence and the stigma associated with suicide. People aren't talking about it. So in this speech, I'm going to talk about it. I'm going to talk about my specific disorder, borderline personality disorder, and give you guys some information about it and kind of some education about it in hopes that you guys can be more comfortable with mental illness and talking about mental illness. I'm going to talk about the definition, the symptoms, and the treatment for it. So first we're going to start with the definition. The DSM-5, which is the gold standard for mental health diagnosis, any psychiatrist or psychologist uses it. Basically, their definition says that borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image, and affects, which is mood, and marked impulsivity beginning in early adulthood and presents in a variety of contexts. So it has specific criterion, but I'm going to talk about that criteria more in the symptoms section of this speech. Previously, BPD has been seen as a behavioral disorder, but more currently, it has been researched that it does have some biological underlyings into it. Some recent studies published by the National Institute of Health have shown that people with borderline personality disorders have abnormal amygdalas. So that's the area of the brain that controls emotion, which attributes a lot of the emotional dysregulation that a lot of people have in borderline, as well as they have a decreased gray matter, which also plays into the mood instability, as well as slower metabolism of some important neurotransmitters that help control your mood, such as serotonin and different things like that. The second topic in this speech is the symptoms. So basically all of the symptoms in borderline stem from a real or imagined fear of abandonment, which is kind of an interesting topic, and I do encourage you to look more into it. It's too much to go into in only a 5 to 7 minute speech, but I'll go over a brief overview of all the major symptoms, but there's a lot more, and they're a lot more complex than I'm going to state. But basically, people with borderline have an unstable sense of self. So a lot of times when they're in other social situations, they will kind of morph into the people that they're with, or their significant other, or their family members. They don't have a real sense of who they are and what their personality is. So often they will take on the traits of people who are around them, major personality traits that the people that are around them, which makes an interesting dynamic for different people in those relationships. They also do have extreme emotions, instability in their moods. Borderline personality disorder has actually been renamed as emotional dysregulation disorder. And they call it a yo-yo effect. So these intense mood swings, they can go from extreme dysphoria, which is like happiness, to depression, to anxiety within moments. This can lead to difficulties with relationships. It can lead to extreme impulsivity. It can also lead to aggression and anger issues. And some of the impulsivity can be promiscuity, binge eating, substance abuse, different symptoms like that. These impulsivity can lead to some suicidal gestures or self-harm. Because of these intense emotions that people feel, they try to alleviate those emotions with suicidal gestures, or they're trying to perform a suicidal gesture to try and get the attention of their loved one so that they don't feel abandoned anymore. Again, a really difficult topic to kind of go over in just a 5 to 7 minute video, but I'm going to try and do my best. So basically, they're not really intending, a lot of them are not really intending to commit suicide. It's more of a rash decision, like I'm feeling this way, I don't want to feel this way, so I'm going to cut to try and alleviate that pain, or I'm going to take some pills to try and alleviate that pain. And oftentimes this can lead to some pretty disastrous situations. If you can only imagine, a lot of borderlines are in and out of inpatient hospitals quite frequently, and they have one of the highest suicide rates amongst mental illness, along with depression and things like that. And the last big symptom is stress-related paranoia. So they become really fixated on what other people think of them, and they kind of sometimes start to think that people are talking about them when they're really not, and different things like that. The treatments, so there's 2 major treatments. There's therapy and medications. The medications just aim to treat the symptoms. There's no cure currently for borderline, but it can be managed. So we have medications for depression. A lot of you guys have probably heard of Lexapro, Celexa, different medications like that. Anxiety medications such as Boost Bar, or medications like Xanax for rescue. And then also medications to help the mood instability like lithium and different things like that. The biggest therapeutic treatment currently is dialectical behavior therapy, which focuses on mindfulness. Again, really big, complex type of therapy. It usually spans over 1.5 years. It's like a whole program, but basically it just focuses on mindfulness, which is a concept a lot of you guys might be familiar with. Living in the present moment. You learn how to regulate emotions and build up your distress tolerance. So I hope throughout this speech you have been able to learn a little bit more about my specific mental illness, and I hope that it broke down some barriers and helped break the silence. I like to end all of my speeches by just saying, you're never alone, and you are loved, and you are beautiful. And I hope that the definitions, symptoms, and things like that give you a better picture.